Hello, everyone. I'm Dr. Shen from Beijing University Cancer Hospital. I'm a medical oncologist focused on GI cancer. HER2-targeted therapy remains the most important factor affecting prognosis in HER2-positive gastric cancer. HLX22 is a novel anti-HER2 monoclonal antibody binding to the same domain of HER2 as trastuzumab, domain 4. But it acts on the different epitope, which allow HLX22 and trastuzumab to binding to HER2 at the same time. HLX22 plus trastuzumab enhance of the HER2 homodimers and the HER2 EGFR heterodimers internalization. The different but complementary efforts promote the synergistic anti-tumor efforts of HLX22 plus trastuzumab. This study chose the prioritized targeting HER2 and not in combination with the immunotherapy to clarify the synergistic therapeutic value of HLX22. Our previous finding, the patients benefit from the anti-HER2 therapy exhibit significantly increased infiltration of the CD8 positive T cell, NK cell, and the B lymphocyte. Furthermore, we discovered subtype marked by CXCR4 positive M2 macrophages associated with poor prognosis were reduced when benefiting from anti-HER2 therapy. This mechanistic insight motivated our phase 2 study enhanced clinical outcome of the HER2 targeted therapy for HER2-positive gastric cancer. The development of HLX22 has gone through phase 1 and phase 2. The data of the phase 2 gastric cancer studies published in ASCO last year. The median follow-up duration have exceeded 28 months. The PFS was not reached in HLX22 combined with the trastuzumab and the Celox arm versus 8.3 in trastuzumab plus Celox arm. HR is 0.2, which reduced the risk of disease progression by 80%. The median OS is also not reached versus 16.4 months. HR is 0.6, indicating that the median overall survival will also exceed 28 months and is expected to surpass the current first-line treatment. The phase 3 international multicenter clinical study of HLX22-GC-301 is HLX22 plus trastuzumab and Celox versus trastuzumab and Celox with or without pembro as first treatment for HER2-positive locally advanced or metastatic gastric cancer or G-junction cancer. This study design has 3 highlights. First, it is an international multicenter randomized double-blind study. A total of 550 patients will be enrollment globally. The population is more diverse in terms of ethnicities and regions. And the study is a stratification strategy based on the biomarker. The subject will be divided into subgroups based on CPS status and HER2 status. The last highlights is that can intensify anti-HER2 therapy improve the prognosis of HER2-positive gastric cancer. This phase 3 study have been conducted. The first administration already complete in China, Japan, Korea, Latin, Australia, American, and Europe.